My name is Monica Kimbrough, and I'm going to give a brief response to our four discussion question. Question number one, discuss the problems of putting children and adolescents on medication tested on adults. I have three problems here. It's one, problem number one is prescribing medication off label. That's a problem. Two, it's a safety problem. And three, it's a suicidal issue problem. In our society today, there are two main identifiable problems for medicating children. One, it's the ADHD problem and the bipolar disorder problem. The main problem identified with ADHD symptoms are inattention, that is, poor attention, carelessness, inattentiveness, easily distracted. The hyperactivity and impulsivity with children is you have difficulty remaining in seat. They run around, they talk excessively, they blurt out answers or opinion, they interrupt and they intrude. These problems are common and they are normal symptoms in both children and adults. I believe that children are still developing, they are still learning, and they are still adjusting to their environment. Could it be these symptoms, could it be that it's an indication of what is happening to the child in and around them? Children are still developing, they are still learning, and they are still adjusting to the environment. We should not be so quick to medicate children. We are all aware that psychological problems are influenced by life events, what happens to us and what happens around us. Medication do not change how people relate psychologically to their experience. Medication do not fix psychological problems. So we should not be too quick to medicate children. They are still developing, they are still learning, and they are still adjusting. I see medication alone as stitching up a wound and there is still pus inside of it. The infection is still there. We should not be too quick to medicate children. We should be looking at those symptoms as indication of what is happening to the child and what is happening around the child. Question number two, what is your understanding regarding the black box warning on antidepressant for children? Is it important or is it not needed? There is no question in my mind that antidepressant can harm if used inappropriately. At the same time, major depressive disorder is an important predictor of suicide. But my question is, doing this public advisory and black box warning on antidepressant for young people, does it outweigh the benefits? We need to take a look, or we need to take a second look at, did the warning prevent many adolescents and young people from seeking care for depression? Is this the reason many of those with depression don't seek help and do not receive effective drug treatment? Or not only or, but and did this cause psychotherapy and other mental health visits to decline? These are the questions I would ask in order to make a judgment whether it is important or whether it is not needed. Question number three is, what is the gateway theory of drug use? Is it accurate or inaccurate? The gateway theory of drug use is that it suggests the idea that illicit drugs begin with the use of tobacco, alcohol, and marijuana. I have heard several people who use illicit drugs agree with this idea, but I have seen people who did use cigarette, marijuana, alcohol, and have never used illicit drugs. So my view is that it is really based on the individual, his environment, and how easily he or she is influenced, and how much of an addicted personality that individual has. Question number four, why do people prefer herbaceuticals to prescription? How would you counsel a client who wanted to use St. John's wort rather than a prescription antidepressant? I believe that there are four reasons why people use herbaceuticals. One, they mistrust allopathic medicine. There's a safety issue. there is no prescription required, and there's a cultural upbringing issue. Personally, me, I grew up on herbs. Our grandparents, they use herbs. And so we learned to use herbs in for many sickness or for many issues that we had. But the one thing I remember very clearly is that our grandparents, in the time of a crisis, they resort to prescription drugs. So I personally believe that when there is a crisis, we should not wait, or one should not wait for a drug, for the herbs to be effective. They should not wait to see that, because sometimes that could take months before you could see the effectiveness of herbs. So I think that in the event of a crisis such as a major depressive disorder, the immediate symptoms of this will exacerbate, it will worsen, it will end up being difficult to be treated if you wait for the effects of herbs. So I think that you should resort to using prescription medication, something that you know has worked, um, rather than wait for to see the effect of herbs. I'm sorry. Thank you so much, and thank you for listening to my response to these questions. Thank you.